Good morning, everyone. Sean Bidixc from Surgical Studios today. Today we have 4 cases, so we got a bit of a long day, but it's 4 individual cases, so not combination cases. We have an extended brachioplasty, which is a body contouring case where we take removal of the excess skin of the arms, but in extended, we take it down to the chest and remove some of the excess skin that's under the axilla and on the side of the breast. That's number 1. Number 2, we're doing an abdominoplasty, so a pretty standard tummy tuck with liposuction. Number 3, we're doing a mastopexy, which is a standard breast lift, no Galaflex today. And number 4, we're doing a standard brachioplasty, so just the arms, not extending it into the chest. I want you to think about massive weight loss patients. If you ever had a piece of clothing, like a full body piece of clothing, and then you lost weight, and you see how it fits. When someone loses weight, they don't lose it in one spot. They lose it everywhere, right? And the more you lose, the more you're gonna see the ramifications all over your body. So when I talk to a patient, I explain to them that their skin suit doesn't fit anymore. It's like your skin suit was built for someone significantly larger than you. And the older you are and the less elastin you have, the less you snap back. So what I started doing with my body contouring on arms and legs, which would be brachioplasties and medial thigh lifts, is adding tumescent fluid, the same tumescent fluid I use for liposuction. And just a refresher, tumescent fluid is basically lactated ringers, which is kind of like the same, it's like salt water with the same like concentrations as blood, and lidocaine for pain, and epinephrine to constrict blood vessels. Good spot. And so, yep. And so you bring this up like this. So you really want to avoid that medial to brachiocutaneous nerve. So here's my mark right here. I can tell you right now, I'm going to get at least a centimeter more than that in that spot. Now the axilla, I haven't even finished my dissection posteriorly yet, because I haven't even reached my mark. So this, I like this. I'm not going to go any further than this. This is about all I'm going to take. So this line, this is the one I redrew. This is why it's important. Can I have a marking pen? I like right here. So you really, look, I want to really get as much as I can, but I'm telling you, I've been scarred by that first case of not being able to close somebody. So better to readjust at each time. So take this, I'm going to have you then get opposite me right here. I move to a 15 for this, please. And a tail clip, knife up. So now this is the big test right here. I can get way more, okay, way more. What am I doing? Yeah, so we're on the closure part of this operation. So it's really important you hold the breast for me. So this is, we close in 3 layers. So this is the first layer, is a deep layer. So on this side, I'm not too worried about it. Just don't buttonhole the skin, right? And really, this is just to take some tension off. So I talk about this all the time. Plastic surgery closure is, the important part of a plastic surgery closure is taking tension off the wound to minimize scarring, right? Yep. So, and we want to leave as few marks as possible. So on this, it's pretty easy. Okay, I'm not dimpling. I got the wound close. You're not pulling a lot with it's going to get you all set up for your 305s, right? Your deep dermals. You have another one? Thanks. Yeah, we each get around. There's a lot of cutting and sewing happening. All right, so post-operative care on our last 2 patients. So the first patient, we did an extended brachioplasty, which is similar to this case, which is just a brachioplasty, which means we don't go down to the torso. Post-op's pretty much the same on both. They'll have steri strips on their wounds. They'll have drains coming out of each side. They'll have gauze with Kerlix wrapped around it and a snug garment on. They'll go all the way down to past their elbows and to about mid-waist. They leave the OR like that. They just leave all the dressings on for 48 hours. Their restrictions after the operation are no heavy lifting greater than 10 pounds, no exercise more than walking. That's going to be for 3 weeks. Range of motion is fine though. They can move their hand above their head if they want to, okay? In 48 hours, they took all their dressings down. They make sure they take their drains and they attach it to either a lanyard or a drain belt and I don't want them dangling. And they can take a shower, gentle soap and water. I don't want them scrubbing all the incisions, but they can definitely soap them up and wash them off. Towel dry when they're done, put some gauze pads back on, put the garment back on. Sleeping, I just want their arms elevated above their heart if they can, so raised up on a couple of pillows. They're gonna come back and see me in a week. Plan is to take those drains out, and then at 3 weeks, we'll start scar massage and I'll lift the restrictions. And then at 3 months, I'll take my final photographs.